Hi, my name is Swati, and I've been coming here for almost 2 years. It all started when I think I hit my menopause. Uh, I was getting uneasy feeling for quite some time. As a layman, I didn't know what to suspect what's happening with me. So one of the times I think I measured the BP and it was fluctuating. So, and it was COVID time. So I contacted a few doctors and talked about my symptoms. So most of the doctors put me on blood pressure medication or bloating medication, and it went on for 7, 8 months. I wasn't cured. So after that, anytime I would be given a blood pressure medication, my BP would just drop a lot. So after a lot of problems, and I think 7 to 8 months, my life really came to a standstill because not able to do anything all day. I was just worried about what's going to happen next with my body, and it was a very difficult time for me. Though it wasn't the anxiety about COVID, but my body, I think, was reacting in a very strange way. So after 8, 9 months, I just heard a neighbor. I was talking to a neighbor, and she mentioned that, she mentioned about a common friend who had been cured by Dr. Nilesh at Whole Brain. And that set me thinking later that maybe I should speak with him if there's a problem that is in his domain. One thing was clear to me, that I had no stigma in my mind about, that I am going to a psychiatrist, because I was very clear I need to get well. And I had tried everybody from gastroenterologist to general physician to cardiologist to everybody. A lot of doctors I had met, and things weren't sorting out. So I met Dr. Nilesh. He heard me out. He ran a few psychological assessment tests with me, and he was clear. He said it's about anxiety, hormonal imbalances happening because of menopause. And he didn't put me on any HRT because there is a history of breast cancer in the family. He put me on some, I think, I would say simple medications, but the doctor would know better. And I think the results were visible in a week. It's been 2 years since my medication has been reducing in a big way. I'm having now almost, he started with very little medication, which was almost, he said, we give to babies. And now I'm even on half of that medication or less than half. So we faced it out. People say you gain weight with these medications. I haven't, I have lost. So, and I'm doing absolutely fine. So, I think he is fabulous. He doesn't, one thing which I was happy about, that he, like me, doesn't believe in over medicating. And I was willing to go the extra miles as a patient, the whatever needs to do in changes I need to do in my lifestyle. And he encouraged me a whole lot. In fact, he focused more on the lifestyle things and guided me on, what all I wanted to do. He said, just do it. Don't think. A very chilled out kind of an attitude. So I think I just loosened up. I got better very quickly. So I would say it's a very, very holistic approach. And I thank my stars that I landed up with him. Yeah, so doing great now, and would recommend anyone who's feeling any kind of, you know, non-normal situation in their life, should meet a doctor, a psychiatrist, because these days we don't know, a lot of, I think, problems originate from the mind, or and particularly the women who are going through menopause. It hit me like a ton of bricks at that time. So yeah, it's always great to meet a psychiatrist and talk to them and get treated. It's more important to get well, get treated, and get back to your life than thinking about कि मैं psychiatrist के पास क्यों जाऊँ and all that stuff. That's not important at all. And I think it's the best decision I ever made.